with my friend John Bivona. John, thanks for joining me again on my YouTube channel.
Sure, it's a pleasure, Preston. Glad to be here.
So I know a lot of people are returning listeners, viewers, because we had a conversation about 5 weeks ago, and I just got such tremendous great feedback from that conversation. So for those who didn't maybe listen to that previous conversation, could you just give a snapshot of who you are and why? You may not like to say it, but why I'm going to say, I think you are an expert. You're an informed voice on COVID-19. So give us the background of who you are and what you do, and we'll jump into our conversation.
Yeah, sure. So I work for the University of Chicago. I am a Senior Biosafety Officer. I work in a high containment facility. So they're technically called Biosafety Level 3 facilities. And we work with high consequence pathogens, anthrax, plague, Brucella abortus, high path avian influenza. So my job is primarily, I got really two things that I do, but primarily is to do risk assessments on high consequence pathogens like anthrax, plague, and even now we're working with the SARS virus, the SARS-2, which causes the infection COVID-19. So my job is to do a risk assessment of the pathogen, and then I train researchers on how they can safely work with pathogen, how they can work with the specific pathogen. So some of the things that we look at, and these are kind of buzzwords in culture now: incubation period, modes of transmission, personal protective equipment, how stable something, a pathogen is in the environment. So basically, we do that risk assessment, and then we send that information to the researchers who are doing the research. And the research that we're doing is looking for therapies, and ultimately vaccines for some of these high consequence pathogens. So, I've been at the University of Chicago for 20 years, and I've been in this research for about 15 years as a biosafety officer. And then in 2014, people may recall the Ebola outbreak. So the National Institute of Health called on people that worked in high consequence pathogens, high containment laboratories like myself, to go around the nation and train emergency responders, nurses, doctors, clinicians, fire, emergency responder, any emergency responders, all the way down to all the way down to custodians, on how to safely work with Ebola. So you have the Ebola patient. Most people in clinical care are used to working with like bloodborne pathogens, but they didn't have a lot of experience working with emerging infectious diseases. Infectious diseases that were with high consequence pathogens. So we went around, we did the whole, Washington, D.C., the fire department, and we trained these people on the agent, how it works, like we talked about a second ago, and how to safely don PPE and doff PPE. So you fast forward from 2014 to now, where just about every hospital, clinical care, doctor's office, retirement home, they're all using procedures now that we have been working with and using for years and years. We have standard operating procedures, step by step, how to put PPE on, how to take some off, and now it's basically mainstream. So that's kind of a little snapshot of what I do.
Okay, so we had a conversation, I think it was about 5 or 6 weeks ago, and you gave, and I've been listening to a lot of different stuff from experts, from political pundits on both sides, and just trying to get my arms around this conversation. I think my conversation with you was probably the most helpful. I just feel like I got just a really good, honest evaluation of COVID-19. We talked a lot about your as you said, an area of expertise of yours is kind of determining, how contagious things are, whether it's contagious through aerosols, droplets, airborne. I even asked specific questions like, if I'm walking by somebody, should I hold my breath? How effective are masks? That was 5 weeks ago. Have you changed, progressed, refined, or continued to solidify different thoughts you've had on COVID-19 in the last 5 weeks? Because every week things seem to be changing. New studies are coming out. Where are we at now with this virus?
Yeah, I think for me, it's been, I use the kind of analogy of like a camera, the old cameras where you see something and then you can focus and get a little clearer picture. So I think since we've talked last, things have become more clear. But I do want to make sure that everybody understands. But because it's a new novel virus, things are still evolving. It's still only been on planet Earth for 6, 7 months. So we do have a clearer picture, but there's still a lot to learn. But I think kind of the take home right now that's really clear is that we know it's very infectious. The
Okay.
morbidity rate, they would call that. So we know it's really infectious. The reproductive number, which means how many people one person can give it to, is between 2 and 3.
Okay.
So that means one person can give it to 2 or 3 people. What we want is if that number is below 1, then we know that the outbreak is slowing down. So we're not there yet. I say 2 to 3, and I put a little asterisk by there because that's the best information that we have because of this asymptomatic cases. So there's between 20 and 25% of cases that people have no symptoms, no fever, no cough, nothing. So that's what's really hard about that reproductive number, because there are so many people that have the virus that would never go to a doctor because they have no symptoms. So that's been made more clear.
Okay.
We know it's relatively low mortality rate, so the death rate is relatively low. Everybody's in the news. We do know the elderly are really taking a hit on that. So that's kind of something that's pretty clear. One of the things that has gotten even clearer is a thing called pre-symptomatic shedding. So let me explain that a little bit. So with the flu, usually you are most infectious to transmit the disease about 3 to 4 days in.
Okay.
So your viral load goes high, right? The virus builds in your immune system, and then as it peaks, that's when you're most the most virus will come out, and where you can transmit it. With this, a lot of the studies now are showing that the pre-symptomatic shedding is really high. So before you have symptoms, before you have a cough, before you have fever, that is in a lot of cases where the peak of where you can transmit it. So that's a really big difference between flu. So that pre-symptomatic shedding is different. The asymptomatic we talked about. So kids still in general have been pretty healthy. There have been some recent cases of kids that have had some greater autoimmune system, symptoms. Not a big number, but there are some small numbers. So we got to kind of keep our eyes, be very intentional about looking at kids. And then finally, we talked a little bit about the recent about aerosol transmission. So there has been some recent studies of aerosol transmission, but the question is it an actual aerosol or were they micro droplets? So last time we talked about droplets versus aerosols. Well, now they've even refined that droplets to droplets, which are bigger in size. So if you think about a quarter, not the scale, but a quarter size, and then about 6 feet, everything drops, with gravity and the size. But now then the aerosol we know are really small. They kind of float in the air like a smoke. Well, now we've kind of discovered with the more research about a micro droplet. So it's still a droplet, but they go further than that 6 feet, and they'll stay in the air a little bit longer. So they're not like a gas where they stay in the air, but they'll go, they'll travel a little bit farther. They'll be in the air a little bit longer, but then ultimately they'll drop with gravity.
Okay.
So of those recent studies of aerosol, people in restaurants and stuff like that, overseas, they're not sure if it was aerosol or it was a micro droplet. So that's still to be determined.
Okay.
But I think just to kind of answer your question in a nutshell, I think things are starting to get a little more clear. Okay. Now that's not to say it can't change.
I still have some questions about that as things start opening up now. For instance, my wife and I, we had our 19-year anniversary last night, so we went out to dinner. First time in a restaurant. Things in Idaho have opened up. We're in stage 2. But things are really spread out, right? I mean, it was actually really nice. It wasn't loud. It was kind of chill. We had a lot of, good attention from our waitress. And is that, if we're inside a restaurant for an hour, hour and a half, we're spread out, we're social distancing. Is it still more likely that we can catch something in the restaurant? Are we at higher risk than, say, walking by somebody on the street? The fact that we're in a closed environment, even if we are social distancing, or is it still yeah, you're putting yourself at risk, or is it like, well, it may be a tiny bit of risk, but it's not that big of a deal? What would be your thought on going out to a
Yeah, kind
restaurant
of
that's spread out?
right into the weeds a little bit. So obviously, if you're outside, your risk is lower, right? Inside, I guess it would depend all on the airflow. So say there was someone that was infectious, at table A, and you were table B, and airflow was going that way, and there was a cough, and
Okay.
airflow was going towards you, and you had those micro droplets. So it's low risk, but I think it would just kind of depend on the situation. But obviously, we call it, time and separation. So the further you're away, and the length of time is going to reduce your risk, right? We can't eliminate it, but we can greatly reduce it by if you're sitting at a table 6 feet away.
Okay.
And
what about?
But
What
yeah,
about?
outside, even Chicago, they're starting to talking about opening it up, and they're talking about closing down streets and making the streets that are adjacent to restaurants part of the restaurant, so they can do more outdoor
Oh,
seating.
okay.
So they're just kind of thinking through that now.
Related to that, I'm still get really confused about the whole mask conversation, especially since it seems to have gotten politicized, almost moralized. And maybe that's a good thing. I don't know, but like, at first, it was like, oh yeah, masks, you can't get sick if you're wearing a mask. Then when that pandemic hit, it was like, well, masks don't really do anything. And then it was like, you have to have an N95, otherwise it doesn't work. And then they're like, but don't get one because the doctors need it. Now they're like, you must be wearing a mask. And then they say, well, you
Oh,
can still
all
get it
right.
with a mask, but you can't give it to others. So I'm just like, where everything keeps kind of changing or adding. Like, can you tell us, like, what do we know about the mask? Should we be wearing a mask in closed corridors, or
Yeah,
social distancing enough?
right. So two things. The first thing, before I answer your question, I think we might get into a little bit later, but when things change like that, that's where trust goes down, right? So, and I understand that, but just to tell people that when you're dealing with something that's a pandemic, it is new, things are going to change. But I think when people see different opinions and things change, and people aren't clear, public trust goes down. And I think that's just, for lack of a better word, ignorance, where people didn't know the difference between a respirator and a mask. But in general, masks reduce your risk, right? So it doesn't eliminate it, but it reduces.
Okay.
So there's really two. So primary reason we wear a mask, again, is to keep your secretions contained inside your mask, right? So that's primary. Secondary, it does reduce your risk when you have a mask on. So if you think if someone were to spit in your face, to be kind of blunt, it's not going to eliminate it, but it's going to reduce it, right? If someone was coughing droplets in the area, it's not like a respirator. It's not going to eliminate it, but it could reduce it.
Real quick, would it be fair to
Yeah,
say it would highly reduce the risk of catching a droplet? It would not reduce the risk of an aerosol. Would that be like if I'm wearing a this is another
100.
question I have. Before they used to mock people saying, look, if you just put a handkerchief around your face, that's not going to do anything. Now they're like, hey, just wear a handkerchief. And, it's like, well, which one is it? So like droplets, just the logic of that. Obviously, if somebody sneezes and I'm having something covering my face, it's going to block that. But I can understand an aerosol. It's like, why air is still coming through. So I would imagine it's not going to filter out an aerosol. Would that be an accurate assumption?
Absolutely.
Okay.
100%.
Okay.
Yeah, right on.
Okay.
You're a
And then
junior biosafety.
and I keep hearing it. Well, I've heard people say, I guess, contrary to what you said, it doesn't reduce your risk; it reduces the risk of you passing it to others. Is there kind of a receiving, passing?
Yes, I don't want to remember. It's not eliminate.
Right.
It reduces it. Right.
Okay.
So that's that. Yeah, I think common sense, along with the science, will tell you if someone spits in your face or sneezes in your face, you're not going to get 100% of those droplets. Some of them are going to be stopped. The majority of them will be stopped by a mask. So it's not going to eliminate it.
Okay.
It's not going to eliminate your risk. It's going to reduce your risk.
So you would recommend in a building, in a closed quarters, social distancing plus mask, just to reduce. Not you're not gonna not
That's
get
right.
it, but it will reduce it. If I'm out walking my dog and I'm no more than 20 feet away from somebody passing by on this side of the road, I don't need a mask. Then it's irrelevant, right?
Yeah, in general, I want to stay away from absolutes here, but
Okay.
yeah, in general, 99%, yes. When I
Okay.
go jog, I don't jog. My wife will laugh at me if I say that. But when I go walking and she's jogging, or I'm riding the bike and she's jogging, we don't wear masks.
Okay.
But there are some places you're going to see universal masking, meaning everybody wears a mask no matter what. So I think if you think individual masking, it reduces the risk. But if you think of public health, where you have thousands of people, maybe in a hospital setting, then you're really it's not one-to-one, but now you're really reducing larger groups of people from contracting a disease. Okay. So yeah, you're going to see universal masking. Illinois, you go outside or you go to a public place, mask.
Okay.
India, recommended.
Okay. For those of you who just joined us, I'm talking to John Bivona of University of Chicago. He's an expert in infectious diseases. I want to get to the whole politicalization of this whole conversation, but because I think that's I don't know, with states opening up, I just seen the rhetoric, the partisan rhetoric, just be really amped up. And depending on which news source I read, I feel like I'm living in two different planets, really. Before we get there, though, there's a new study you mentioned offline that came out that's really important. Can you tell us about that study? I think it's from the CDC.
Yeah, I think this will open up, I think, a lot of questions. But I think this is kind of where we're going. So there's a Centers for Infectious Disease Research and Policy. So I am part of my CV also is that I'm a registered biosafety professional with international ABSA, so that's American Biological Safety Association. Okay. So these are the biosafety experts from all over the world. We do conferences, best practices, that stuff like that. So there is a group, like I said, Centers for Infectious Disease Research and Policy. So their expertise from epidemiology, virology, bacteriology, microbiology, all the best people in regards to biosafety. So what they did is they came out with a study, and it's been on the news a couple times, but let me just kind of give you the summary. But they looked at the last 8 pandemics, starting with 1918 flu, and they wanted to look for similarities, different scenarios of how they peaked, when they peaked, if they repeaked. Before I get into that, because this is a good broad picture, most of us are Americans and we just think American, but this was just focused on Northern Hemisphere. I wasn't focused on the Southern Hemisphere. So as bad as it is, or it could be here, when there's outbreaks in Southern Hemisphere, you think about the infrastructure that we have compared to them is night and day, right? Mm-hmm. Comorbidity, so meaning other stuff that could lead to death. Northern Hemisphere, you go to Southern Hemisphere, you talk about HIV, TB, malaria, malnutrition. They have chronic respiratory diseases. So this study is just for America, Europe, kind of, the Northern Hemisphere, because so what we see, what I'm going to give you some scenarios, what it's going to look like there could be, extremely worse. Mm-hmm. So they came up with a couple different scenarios, but this is based on if we don't come up with a safe and effective vaccine. So keeping that out, because that could be a game changer. A little bit about vaccines, though, is that's what I do, right? So vaccines, I know there are some very ambitious conversations in the media by even the president, and about 2021. That would be very ambitious. It's possible. Probability might be, if I think of probability, 51%, not probable, 49, it's probably not probable, but it's possible, especially with the number of facilities that are working on it, right? So there's been tons of funding that have gone to research facilities. So that will increase, the probability of getting a safe and effective vaccine. So with this study, they're saying, hey, we're not going to get it. So of the 8 pandemics, 7 of them had early peaks followed by a bigger peak about 6 months later. Okay. So they talk about going back to normal, what that would look like without a vaccine. So you got to remember, they talk about herd immunity. Mm-hmm. So I'll talk a little bit about that. But that is basically when the majority have immunity. So if you don't have a vaccine, The only way that is going to go back to normal is when the majority of people have it and become immune to it. So the percentage is a little vary, but it's usually between 60 and 75% of the population need to get herd immunity, and then we're back to normal. So we're about 10% now.
Okay.
So this study says it's about 18 to 24 months to get herd immunity. So that's 2 years, a year and a half to 2 years. So thinking that. So there's some background information on that. So let me give you the 3 scenarios.
Okay.
You good?
Well, I was just going to say, so you're saying herd immunity plus vaccine are both probably not going to happen in 4 to 6 months. I mean, it's going to be 2021 best case scenario, probably.
That's correct.
Okay.
Yeah. And I'm going to give you all 3 scenarios that they give based on all the last 8 pandemics, and all of them go to 2021. None of them are done in July, and then it's like a light switch, and we're up and running. So the first one, we'll kind of go through these quickly, but the first one is called peaks and valleys. So the first wave is what we're going through now, and then we'll be followed by repetitive smaller waves until 2021. All right. And it'll vary by geographical location. So obviously you're in Boise.
Yeah.
I'm in right outside Chicago. It's going to look a little bit different. The second one is called the fall peak, and that's what we talked about a little bit earlier, but it's one wave that we're in now, followed by a bigger wave, 4, 5, 6 times bigger than we're in. That was consistent with 1918 and the 1957 pandemic. And then after that, we have smaller waves until 2021. And then the final one is called the slow burn, where we have the first wave that we're in, and then for the next year and a half, it's just, there's really no pattern, maybe little peaks, little valleys, but it just kind of slow burns until 2021. And again, that would vary by geographical location.
Okay.
So I think the take home is that for a mentality, Preston, is not a light switch. And I know we like this in America. We like on, off, open, closed, black, white.
Yeah.
I think the mentality more has to be a dimmer switch, right? So a little bit open, a little bit closed, maybe a little bit more open, fall peak, come again. I don't know what society will do. There's going to be some governments, if we have a bigger peak, that are going to shut everything down. So those are kind of the scenarios that we're looking at. And I think it's pretty realistic. There's always the hand of God that comes in, right? So that's the wild card. That's the ace that where we have where it just to quote Trump, it just disappears, right? So that's possible. Probably not likely.
Okay.
But I think the mentality is that dimmer switch.
Okay. So related to that, I guess then. So what are your thoughts then on slowly reopening? I mean, I think all 50 states now, last time I checked, have some kind of reopening happening. My state, we didn't really shut down that hard. Idaho, and people moved to Idaho because they don't want to obey any authority outside themselves. So I mean, we're by nature, a lockdown probably wouldn't even have worked here. But our lockdown was really mild. Our cases were very low. We had a big outbreak up in the mountains in a small mountain town. I think I had the highest at one point infection rate per capita, more than New York. It was off the chart. It was kind of contained. And then, I live in the most populated part of Idaho, Boise, and this whole area. And it's been fairly mild. Our opening up strategy is, I think, pretty balanced. I think it's good. I think we have a 4-stage thing. So far, we're in stage 2. Things don't seem to be, the hospitals are empty. Anybody can get a test. There's more tests available than people getting it. People seem to be social distancing pretty well. Anyway, and I know each state's different. Florida and Georgia, big debate. They opened up early, and from my understanding, the massive apocalypse that was going to happen because they opened up too early hasn't happened yet. Maybe it will, but it's given some people hope. Other states I know, like California or Southern California, at least, you can't even sit on the beach, even if you're 100 yards away from somebody, which to me doesn't make sense, but I don't, I'm not an expert. Anyway, that's, I'm trying to to as a non-expert looking at all this stuff that's going on, then all the political rhetoric that's thrown into it is just like, and I'm nonpartisan. I don't have any investment on either side. I might have some values that would be more progressive, some more conservative, whatever. But like I don't, which, Babylonian tribalism doesn't really interest me. I'm an exile here. What are your thoughts on reopening and the politicalization of it all? I know it's a big question, but
yeah, no, and I'm right here. I'm 5 miles from the border of Illinois. So Illinois and Indiana have different. I think Indiana's a little more less conservative, where they're starting to open up. Actually, the 24th, I think we go to phase 3, which I think that's 50%. Don't quote me on this, but they're opening up more restaurants to more people. Still social distancing and stuff like that. They don't require masks. And then so that's Indiana, and then Chicago, or Illinois, I'm sorry, is opening up to like a phase 2, where they're starting to open up some restaurants first. So I think as long as it's done, I like the phased approach. That way you don't overwhelm stuff. But so I think that's a good thing. With the dimmer switch mentality, I think my opinion is a good thing. I mean, you got to open up sometime, especially if the public health people are telling us it's going to be 2 years. You can't stay closed for 2 years, right?
Yeah.
So, but I think if it's done, with intention and with in a responsible manner, I think it's good.
Okay.
But I understand that if you're in an urban area like Chicago, where you have Michigan Avenue, where you can on a Saturday in June, you could get 1 million people down there. I don't know how that's not going to spread it, because one of the things with infectious diseases, we'll get political in a second.
Okay.
But one of the things with infectious, what they do is they infect. So it's not Republican or Democrat, conservative, Christian, Buddha. That's what it does. They infect, right? So there's people on the right, people on the left, but the virus is going to infect people, right? That's the germ theory. I hope everybody doesn't think that's a conspiracy, that germs cause disease and germs can get on your hands. And so, but we're almost at that point, I think, Preston, politically, where people there's some people that want to open up no matter what, 100%. And if people die, they're going to die. But they're not thinking that people are going to get sick and die, if you just go 100%. So yeah, I think politically, I think I think we're at we could be really at a dangerous point politically, because so I vote, I pray for the leaders, but as I said earlier, I grew up really, really kind of, I'm a child out of the moral majority and the right. What is the moral majority and the religious right? And then through the years, I'm like, I'm starting to get uncomfortable about, them creating the kingdom of God on earth with their kind of thought process. So I vote and stuff like that, but it kind of scares me on both sides politically, because I see both sides. I see the president politicizing this. I see the Democrats politicizing this. Mm-hmm. I see the news media politicizing this. Where you see that just the death numbers. I see reports, and I'm not an investor. I don't know. I can't validate either of them. But there are people that are saying that the government's the numbers of deaths are way too high, and if you're COVID-19 positive but you die of something else, they're still using those as the number. And then I see people on the other side in Georgia and Florida where they are suppressing the numbers so they can open up. So I am not naive at all to think that any political person on the right or left will not use this above, the public health. And I believe that I believe that's happening, and it's corrupt. Everything is corrupt. I remember one of the articles you wrote is that, when there was the fall of man, it corrupted everything. Yeah. and I know you kind of get into, the sexuality thing, which is 100% true, but it's corrupted the right, it's corrupted the left, it's corrupted the churches. So, it's corrupted public health, it's corrupted, the U.S. government. So,
Yeah.
yeah, it's just hard to listen to politics, and not your level of trust just go in the cellar. So,
yeah.
it's very political now, and I don't think it's going to get any better. What we talk about these scenarios, wow, it's in fall. It's an election year,
Yeah. We've got to thank you for that, and I couldn't agree more. And I've got my own kind of political thoughts as kind of a spectator looking on at this kind of tribal thing. There's some questions coming in. If you do have a question, please go ahead and raise it. I'll give you, here's a couple statements that you might appreciate. Number one, this is much more sane than the nonsense that's out there. So I appreciate that comment. Another comment, John's one of the most level-headed guys when it comes to this topic. So the first question, though, is what's the latest on the life of antibodies in our system? Do they have any idea how long they last? And are there any cases of second-time infections? I had that same question. If you get it, are you totally immune or not? Or where's the science on that right now?
Yeah, I was just in a meeting this morning and we were talking about that because we don't know yet. It's more likely than not that you will build immunity antibodies when you've had it. It's just a question of how long will that last?
Okay.
Will it last? And then it depends on the individual, but someone could build up enough immunity, enough antibodies where they wouldn't get it. And then it's possible, because we don't have a lot of data, that it's possible to be reinfected. We don't know that. I have heard people that I've known that have been reinfected, and I do air quotes because the question is have they been reinfected? So they got it, they tested negative, and then they tested positive, or did they get it and they had a false negative, which we know there's some tests where there's 50% false negatives. Mm-hmm. So, or is it that their viral load is really low where that test didn't detect it, and then their viral load peaked, and then they got it again. So those I think it's more likely that people just had the virus the entire time. But it is possible that you could get it. You could be positive, completely negative, and then positive. But I think it's more like a positive, false negative, starting to feel better, and then your viral load goes higher, and then you test positive again, if that makes sense.
Yeah. So at the end of the day, we just don't have definitive scientific evidence either way, whether you can get it again or whether just a test, the measuring whether the people that have gotten it again is even accurate. That's fair to say?
Yep. Even antibodies
is it possible to get it again, but the virus is just kind of dormant, or it's not like you can get it again, but it's not going to affect you? Is that, did I read that somewhere? I guess or that you can't even pass it on if you do get it again, it's no longer infectious or something, or is that?
I don't know if you could, the question about passing it along, but what would be consistent is if you could get it again, it's possible to be asymptomatic, meaning you don't have any symptoms.
Okay.
But I do think it's more likely, now I don't want to be absolute, but it's more likely that the person was still positive, but they tested negative.
Okay.
And it would depend on that time frame of positive on this date, they got released from the hospital on this date, and then they were positive again. So if it was like in a 2-month span, I would probably say it was the same infection, they just were false negative.
Okay.
As opposed if I saw 6 months where they were healthy for 4 months, then I would think maybe they got reinfected.
Okay. Next question here. Why has the conversation shifted so severely from flatten the curve, that inferred we're all going to get it, but we can't all get it at once, to we can't open until we find a cure? That's a good question. We have flattened the curve, right? Would that be fair to say? Is that kind of beyond dispute that the curve has been flattened? I keep hearing that the hospitals, I know in Idaho, and even I heard in LA, that there's we can handle lots of cases now, it seems like, right? We have more ventilators. That's another question too. There was a desperate cry for ventilators, and now it's like we have so many ventilators laying around, I heard, and then they don't really do much. Or again, I don't know who to trust because all this is so politicized. But anyway, the flatten the curve thing. How are we doing on flattening the curve, and what does that mean?
Yeah, I can, but I can't speak of firsthand is Chicago, right? So outside of New York and maybe a couple other locations in the country, we're probably one of the places that had a lot of numbers. So yeah, we flattened the curves. University of Chicago has a lot of beds. One of the things of going to phase 2 for Chicago was to make sure that we did that. So I'm assuming that if it was University of Chicago, which is one of the biggest medical centers in the Chicagoland area, that we're good. So, but yeah, it has shifted. The conversation has shifted a little bit until to, and I have colleagues on both sides of this where it was flatten the curve, and now it's shifted to no one gets sick or until we get a vaccine. Mm-hmm. And that's a really good question, and I think that the decision makers really should be a panel of experts and not just public health. Mm-hmm. But sometimes, I mean, public health obviously has a big seat at the table, but it shouldn't be the only table. So, because it could get political, and it could, where people are just like, no, we don't, we're going to wait. Like Illinois, there's a couple states that have said that they're not going 100% open or back to normal until there's a vaccine or herd immunity. And those both, like you said, it's not coming in 5 or 6 months.
Yeah.
So are you going to flatten are you going to be off, for 18 months? So, yeah, good question. Go.
Here's where I'm going to get really annoyed and political, maybe, and maybe totally ignorant. Okay, this may be totally ignorant, but here's a genuine question. Is there any human being who is a strong advocate of staying locked down much longer that doesn't have a job that's unaffected by COVID-19? I'm going to hear loads of like media outlets, whatever, like saying we need to keep locked down. Let's wait until we get a vaccine. Every single 100% of my anecdotal experiences, well, they have a job that's unaffected. They're not sitting home with no money coming in, children to feed, rent to be due, a pantry with no food in it and no job. I don't know a single person that's in that situation. It's like, yes, let's stay locked down indefinitely. That just seems like an elitist kind of statement. And absolutely, I think there's an irresponsibility of just blowing open the doors and running around kissing everybody in the street or whatever. Like, I don't know anybody that's even saying that, but to like not kind of explore some kind of mitigated, like, we can't just stay in our homes indefinitely. And yet I need to make some money because I can't just sit around and starve to death in my home. Is that a fair assessment? I mean, what am I missing here? The people that are I'm not pro lockdown, but hyper pro lockdown, they all have job security, it seems like.
Right. And yeah, no, I agree. I think we always talk about, in general, right, that universities are ivory towers, right, and they dictate what goes out to the lesser man.
Yeah.
And because my loyalties, are towards the kingdom of God and God, I see that, there's no doubt that there's media. It's easier for the people on the news to say stay home when they have jobs.
Yeah.
It's easier for public health and researchers to say stay home when I have a job. I haven't missed a beat, thank God. But yeah, I think there's a lot of societal components, where you talk about the elite, politics, and then there are people that need to work, right? There are people that can't social distance. If you go into urban areas, mm-hmm. And you have three generations living in the same house in an apartment, tell them to social distance, mm-hmm. right? It's impossible.
Yeah.
So there's health. So those are all components, the virus is a component where it infects. One of the interesting things is that for some reason, this virus is, when it comes to severe symptoms, is very ageist and racist, where it's affecting the old people and it's affecting in general Black and brown, Hispanic, and the African American, where it's really targeting other factors, but it's really targeting those populations so yeah, there's so many different societal components that is really merging for like this
Yeah.
possible perfect storm.
Yeah.
You know, I don't understand. This is kind of the elitist thing. I don't understand why a mayor or a governor can say that Home Depot can stay open to sell flowers, or liquor stores can stay open,
Yeah. Right.
but a small bit mom and pop business that is selling, I don't know, stickers or whatever, whatever their product is. Why can't small churches open and still have the guidelines, 6 feet, wear a mask? That's just not consistent to me.
So that's
I
related
know.
to our next question that came up. This question says, "What advice would you give to a church as this, the stages of opening up are coming into play?" So similar to a business, as you've already said, it isn't logical to stay closed for 2 years if we follow the projected models you suggest. So for churches, what would you, as churches are able to open up in some areas, I know it's different depending on the state or even the county, what advice would you give the churches that are starting to open up?
Yeah, that's a really good question and a tough question because they're almost at,
Yeah.
they're almost conflicting lifestyles where you have a virus that infects with close contact, and church is about community. It's about hugging your neighbor and good to see you and shaking hands and seeing their be face to face. So I wrestle with this. I've had a couple churches reach out to me. Two churches that say, "Hey, what should we do?" You have these federal guidelines, 6 feet. Obviously, that's going to be regulated. Like, hey, you got to be 6 feet, but just in regards to still meeting. So, say you had a church of 1,000 and you're going to go down to 200. 200 is still a big number,
Mm-hmm.
And I mean, there's been a lot of churches on the news that have decided to meet and now they've closed because there have been outbreaks.
Yeah.
So that's a really, I just think good practices, the best that you can do is 6 feet, all the stuff the government does, 6 feet, elderly, so that's another
Mm-hmm.
question. Elderly, how hard is it to tell elderly people to stay home, Preston?
Yeah.
It breaks my heart. I have an 80-year-old mom and she
Mm-hmm.
can't go to church. I mean, she was widowed and God, was her everything,
Mm-hmm.
and she can't see anybody now,
Yeah.
so
Yeah.
you know, so those are tough questions. I don't know the answer,
Well, and from
easy
my vantage
answer
point,
to that.
I don't want to equate church with large gathering in a building. I'm not against large gatherings in a building. I do them all the time, but it would be linguistically and theologically inaccurate to say that the federal government is not allowing us to kind of be the church or go to the. I think there's many different ways you can be the people of God without gathering together in a large setting inside of a building. I mean, when did that happen in the New Testament? It never happened, actually. All the large gatherings were outside, and maybe that's the. I think there's possibly some maybe creative ways to even gather outside in parking lots, whatever. It's uncomfortable, whatever. Well, yeah, but if U2, I'll U2 fan. If U2 was going to put on a free concert outside, everybody would go, right? So we could do something
Right.
outside that might be a little bit uncomfortable. I don't know, and
Yeah,
maybe it's not
I
even.
think.
If it's raining again, if U2 is playing a free concert and it started raining, bring an umbrella. Like, I'm not going to miss a free concert to see
uh,
Bono. So I mean, I don't know. Like and we can take care of grandma. We can love our neighbors. We can take care of each other without gathering together and having a worship service in a building. And again, I'm not saying that anything negative towards that thing. I love large
no,
gatherings,
I
but
know.
it's not. We can still. We can't. We haven't been shut down from being a church in this moment. Because I'm also nervous about. There was a church in Northern California that started gathering, and a huge outbreak happened. It's like that just doesn't send a good message to the world that Christians are truly about loving our neighbor as ourselves. When we gather together, huge outbreak, and now there's people spreading it, and people are dying, and it's like that just doesn't make the church
No, right.
look good, right? And so I don't know. It is a hard. I don't know. It really
But
is a
some
hard
people
balance.
don't.
I don't know. I have the answer to it. It's
No, neither do I. And some people, what you're talking theology, I agree 100%. But some people don't think like that or agree. They think it's
Right.
a building, and for whatever reason, they can't get out of that mentality, and then they're shut down.
Yeah.
You're right, but so
Yeah.
yeah, that's a tough.
So do you have any thoughts on when sports are going to happen again? I mean, I just that has to be. I mean, on the one hand, I can't imagine Americans going without like the NFL or whatever, or any sport really, for very much longer, and yet that's got to be the worst place for a virus to spread. Sitting in hard
No,
surfaces, in crammed quarters, and everything. Do you have any thoughts on that? I mean, I just, yeah, I don't know what's gonna happen. I just,
yeah, from time to time. I listen to sports radio, and they're so the two questions are: can sports happen or with crowds,
right.
fans? I don't see how fans are going to be able to, even if they 6 feet distance. I mean, I'm not thinking that through, but for public health, I can't imagine you can get 100,000 people and say, okay, we're only going to take 20,000
Yeah.
people and put them in the stadium. I'm like, I don't think so. That's with the fans. And then I just think then it becomes with the athletes, so they can get tested like 5 times a week, but I can't get tested, so that's going to be a big
Yeah.
political football, pun intended, where how come these athletes can get tested 5 times a week and,
Hmm.
my grandma can't, or, so,
Yeah.
I mean, they're making plans. It sounds like they're trying to make plans, but I think we're still a ways away because there's so many logistics that they got to think through that aren't just football related and social distancing related.
Yeah.
Have to do with kind of practically having testing and stuff like that. So
I've got kind of a related question, and this is really directly related to my life, I guess, is speaking of income and job and ministry and church and everything. I mean, most of my income, ministry, livelihood is connected to speaking at gatherings, conferences, and a big part of our ministry, as you know, is doing leaders conferences. When would you, and I would say the attendance would range anywhere from 100, and I think our lowest was like 130. Our biggest was 370. Do you see that happening in the fall? Non-worship, like Sunday worship gatherings, maybe inside a church at 100 to 200 people? Or would you say, yeah, I would probably say that's not going to be happening at least until we get a vaccine?
no, it depends on the state, obviously.
Okay.
I don't think I would be shocked if Illinois and Chicago let churches of 100 meet. I'd be wrong. I know there's been, some lawsuits and stuff like that to say, hey, if Home Depot can social distance and mask, why can't we, at church? But Indiana, I think after July 5th, you can meet over 250 people with masks and social distancing. So yeah, I think if you can do it
Okay.
with a dimmer switch mentality, I think if you open up with some of the guidelines,
Okay.
it can be done safely. But boy, I could see that turning into chaos too.
Yeah.
I could see outbreaks happen, and then I even heard just some like Ford plants or different manufacturers said, "Oh, we're opening up," and then they had to close because they had
Right.
10 cases. Because what infectious diseases do, they infect. So when you have groups of people, that's what's going to happen.
And in the
So
fall, I mean, you're saying there's at least a chance, perhaps a likely chance, that some kind of second wave is probably going to flare up again, September, October, maybe. Would that be a
much more likely than not? Much more likely than not.
okay?
Yeah,
Well,
with
that's
flu.
discouraging. What about one more again personal kind of question is international travel. My family and I, we saved up for a long time, planned this vacation, the South Pacific. I mean, it took a ton of work, ton of saving, canceled everything. I mean, it was the saddest thing.
Yeah.
We love to travel. When are we going to be able to get on a plane and travel internationally? Would you say that's? I guess it depends on the country. Like,
Sure.
if everything's still shut down in France, well, who wants to go visit France? But
Yeah.
do you have any thoughts on when?
Yeah, I think that's not the question of when you can travel. It's when can you travel and not have to spend 14 days in a hotel room quarantining.
Right.
So that's going to be I had a colleague, his dad passed away. He's from Taiwan. So he traveled to Taiwan and he's in a hotel room for 14 days before, and then they're going to do the funeral. So I think right now, wow, Preston, I don't know when that's not going to be. That's not going to happen if you travel internationally and you have to spend the first. So if you have a 4-week vacation, go for it. But if you only have 10 days, again, it's going to be dependent on the country. And then depending on where you go, you might have to come back and quarantine for 14 days.
So is that a common policy now? Right now, traveling internationally is a 14-day quarantine. I know like Hawaii and other places have that. Is that
depending on the country? Yeah, but I think every country is going to have something consistent where if you want to come here, so I think the idea is people that are going to stay for long periods of time. But for vacations, I don't know the exact answer, but I think if those regulations stay in place, I know the State Department has it for the United States. Okay. That you're gonna have a time where you're gonna have to quarantine.
Okay. One more question, then I'm gonna have you finish this out with any final thoughts you have. So the final question is: outbreaks don't equate to death, right? Isn't the shift toward that becoming synonymous part of the issue that we're facing currently, or is that incorrect? Do I need to read that again, or did you get the gist of that?
Yeah, read one more time.
Well, let me reframe it. Do outbreaks equate to death? Isn't the shift toward dude, can you restate your question? I'm not going to say your name. He's a buddy of mine. I don't know if you want me to. Well, your name's on there, right? Everybody can see it. Do outbreaks equate to death? Like, could there be a second wave, an outbreak, and the death rate to not just kind of explode?
Sure. Yeah, it could be both. Because this is a virus, it could mutate. So you could have another. So we could have a fall peak, and mortality, the death rate be higher, but that's not likely. But it's just a numbers thing, right? The more people, the more deaths, even though it's a low mortality rate. Okay. But yeah, I guess it's. Yeah, I think anytime you have an outbreak, you're going to have deaths, but the number might be really small, or the comorbidities that we talked about, where if you had other issues, they would add on. So if you had, whatever the issue would be, the health issue could be a factor.
It seemed, from my vantage point, again, correct me if I'm wrong. Obviously, older people with underlying health conditions are much more at risk. Not that young, healthy people can't get it and even die from it, but the percentages are vastly different. It seems like now, I know there was like a whole controversy in the nursing homes in New York. I mean, I think I heard somewhere that if you add up all the deaths that happen in nursing homes, it's something like, correct me if I'm wrong, like 30-40% of all the deaths in America. Something like that. So, I mean, I think we now know, like, man, we have to be vigilant at protecting nursing homes, those with underlying health conditions, old age, whatever. Like, if there was a second wave, are we more prepared to make sure that the percentage of deaths just don't really increase significantly?
Yeah, I think we have controls in place now for the elderly and long-term care facilities. There's controls, but I think people are, there's workers it's the workers that bring it in, and they don't have the right procedures or policies, or they make a mistake, and then that's how it goes in. So I think that mortality rate with the elderly, once they get it, will be pretty consistent. But I do think that we'll have better controls in the place when, if there's another peak.
Okay. John, any final words for us and our audience before we go?
No, I just appreciate it. I stress all the time when I talk to any, people that are Christians, to make sure that our loyalties and our allegiance stay with the kingdom of God, because it's a possibility. I mean, I'll be 50, and probably from since I've been in the 20s and 30s, we've always heard of apocalyptic stories of not necessarily the end times, but just bad times happening, and those have happened from time to time in history, right? So if this is our season where we have to go through it, let's be the light of the world. Let's bring the gospel, to a dying world that needs they need a superhero. They need a savior. So let's be the church, and let's do that. Let's not get involved in all the crap, the political crap, and science versus business, and business versus this, and Republicans versus Democrats. Let's be the let's be the church, and let's use this time to really go forth.
That's
So
a
that's my final message. It's
that's
not
a
really it's not a science message, but
no
that's more,
no
as
that
passionate as I am about my job, I'm more passionate about the kingdom of God and leaving a legacy.
That's a absolutely perfect word to end on. So you've been watching my YouTube channel. Thanks for tuning in, John. Thanks for all of you who tuned in and asked some really good questions. Sorry we didn't get to all of them. If you're watching the recording, please subscribe to my channel. Drop a comment in below if you have any further thoughts or questions about this interview. So until then, we'll see you next time on my YouTube channel, whatever it's called. Press and Sprinkle, YouTube, whatever.